Hey everyone. So for mine, I was in Nebraska, McCook, Nebraska, very small town. It was called a community hospital, so it was a facility within the hospital. So my time there, mostly we saw was a variety of patients. So it was an outpatient facility, so we saw people from the ages of 13 all the way up to like 80. Mostly the diagnoses we usually saw were shoulders, total knee replacements, ACL repairs, and rotator cuff tears or frozen shoulder. Those are mostly the ones I dealt with. I saw one ALS patient. I saw a few pediatrics, and I was able to experience like one acute care, and then also see a surgery, which was really cool. So for their documentation, it's like a hospital set up program where they click on the patient and then it opens up a daily note. It has tabs of subjective, objective, assessment, and plan of care. All that was pretty straightforward, just like how we do in class. And then so with my time there, some things that caught me off, like the reality of it was, so our first day there, I was asking my PTA that I was with the whole time, what's the caseload today? And she said 16 people. I said 16 people. That's a lot. Once we got started and we got going with the flow, it was already 12 o'clock. She's like, yeah, go for your lunch break. And I was like, wow, we saw like a matter of 8 people that quick. And I feel like I didn't feel like that. So it's pretty crazy how quick the day goes on by. One of my least favorite moments that you experienced, I would have to say, so we saw wound care, and wound care is not my favorite. So just observing it was very cool, but seeing it, it was a it was a sacrum gash that was open. It was pretty deep. It was a pressure ulcer, stage 3, and it was pretty deep and pretty gnarly. But looking at that, it was probably like one of my least favorite moments. Besides that, but it was still a cool learning experience. So one of the most challenging things I think I faced was more later on in the weeks where my PTA, my CI allowed me to take more hands on one of the patients. And it was the hardest part for me was progressing or regressing an exercise on my own. She let me do like a few balance ones. At sometimes I felt like I should have progressed, but then also didn't. So I was hesitant and when to progress and push forward. And then I just need some clearance from my PTA at the time to help me out. I think my biggest takeaway moment is you put in the energy that the patient puts into you. So when there's someone's coming in, and we had a patient where she came in, she was a young 13-year-old girl who would just hear for the motions, try to communicate with her. She wasn't really talking. She was just going through it all. And then, so yeah, my PTA still took her through the exercise interventions that she had planned for her, but like didn't go above and beyond putting out for her because it's hard to put so much energy into somebody when they're not going to return the energy as much. So then it's hard to help grow someone. So then she just always told me, my clinical instructor told me just to match the energy of the person that you're with and try to bring them up first. But if they want to keep it down, then keep it low. Don't overdo it. And I think that's one thing I think I took away. The big aha moment for me, for sure. One major thing that I think everyone could take away from my experience is don't be afraid to ask questions to everybody. Like, I was with mostly the PTA, but there's a bunch of PTs in there, and I just picked their brains because they're all PTs, but they all had a special expertise that they were in. Someone was with wound care, someone was with joint mobilization, and then someone was with sports. So just picking their brains and seeing like how they think and the process in which they go through their exercises and how they adapt it or how they change it is just really interesting to see throughout the whole time. I think that's the one thing I would really encourage everyone to do is just keep asking questions to all the PTs and all the PTAs in that area. So at my site, communicating with everybody really went well. There was no problems where I felt like I had to like pick around or like chase somebody down. Where everyone was very open and willing to help out and make everything easy in communication wise. I think the most challenging thing being there with the communication was probably just understanding their lingo. I guess they had a few different things that they spoke and how they approached things. I just had to adapt to and change to a little bit. But besides that, it was pretty easy to transition after like the first week and a half where I started understanding more of like how everything's working. Most of my time there, I was with my PTA that I was assigned to as my clinical instructor, but also at times I was with another PT who was like the head of the area a little bit, and I communicated with him a lot just about more questions or so like why I do this approach, why I focus on this, and then let me experience more hands-on since he was certified in joint mobilization. Like at a high level, he showed me a bunch of techniques that were really interesting and cool and able to apply. There was two PTAs at my site. One was for acute care, and then one was outpatient. So they didn't communicate too much with each other, but a lot of the PTAs communicated with the PTs. If they got a new person in, and then the PT evaluated them, they go in and talk to them and saying, "Hey, any heads up with this person before I go grab them and start my session with them." And then there's just short communication of like key things to look at and like key points that they want them hitting. I think that was really cool to see, just like that quick communication right before you get to bring the person back and understanding like what the goals are and what the purpose we're doing with this patient at the time. So also with my PTA, she was very helpful in just allowing me for a bunch of experiences. So she allowed me to get hands on immediately the first week, which is really awesome. I think it's awesome they do that. Allow me just to get in there and she gets to see what I know and don't know well. And I think that helped me grow as like adapting and being able to get hands on early. Because she said like a lot of our hands are still like children, like baby hands, where we're not fully developed in what we're doing there and like knowing what to feel for techniques wise. But overall, though, as more as I got on, I get definitely way more confident with my hands on experiences, and I think that made me better after this clinical rotation. And then overall, just looking at the whole aspect of the PTAs and the PTs all working together, the location I was at was very big family oriented, where everyone was just communication wide open. There was no interferences. The only time it was hard to communicate was when someone was out of town, or sometimes she talked about how people do evaluations differently from person to person. I think that's the biggest thing that I took away from this was just assessing how each person writes an evaluation, because some people overextend with information, some people put barely any information, and it just how you need to communicate and how you need to pick the brains of the PTs that you're working with at the time. But overall, yep, a wonderful experience, and I can't wait for my next one. Take care.